Question 1. Consider a scenario where a certified Qigong instructor is developing a new introductory Qigong course. They are tasked with explaining the core theoretical concepts to beginners. Which of the following approaches best aligns with the theoretical foundations of Qigong and the professional standards expected of a certified Qigong instructor? Option A. Present Qigong as a form of exercise that is beneficial solely due to its physical exertion, downplaying any energetic or theoretical components. Option B. Emphasize the historical development of Qigong, explaining concepts like Qi, meridians, and the principles of yin and yang as they relate to bodily harmony and energy cultivation. Option C. Focus primarily on demonstrating a series of aesthetically pleasing movements, assuring students that the benefits will manifest through consistent practice without detailed theoretical explanation. Option D. Introduce advanced, esoteric theories about Qigong's ability to manipulate external energy fields, citing personal experiences as primary evidence of its power. Correct answer is B. Emphasize the historical development of Qigong, explaining concepts like Qi, meridians, and the principles of yin and yang as they relate to bodily harmony and energy cultivation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified Qigong instructor to navigate the theoretical underpinnings of Qigong while adhering to the specific regulatory framework and ethical guidelines of the certified Qigong instructor exam. The challenge lies in accurately applying theoretical knowledge to a practical teaching context, ensuring that the instruction aligns with established principles and avoids misrepresentation or unsubstantiated claims, which could have implications for client safety and professional credibility within the regulated scope of practice. Correct approach analysis. The correct approach demonstrates best professional practice by grounding Qigong instruction in its theoretical foundations, specifically referencing established concepts such as Qi cultivation, meridian theory, and the interplay of yin and yang, as understood within the context of Qigong's historical development and recognized pedagogical frameworks. This approach ensures that the instructor is not only conveying physical movements, but also the underlying principles that give Qigong its efficacy and meaning, thereby providing a comprehensive and ethically sound educational experience. Adherence to these theoretical foundations, as implicitly or explicitly recognized by the certified Qigong instructor regulatory framework, ensures that the instruction is both authentic and responsible. Incorrect approach is analysis. An approach that focuses solely on the physical postures without acknowledging or explaining the theoretical concepts of Qi flow and energy pathways would be professionally unacceptable. This failure stems from a lack of adherence to the theoretical foundations that are integral to Qigong practice and instruction, potentially leading to superficial understanding and diminished benefits for practitioners. Ethically, it misrepresents the holistic nature of Qigong. An approach that introduces speculative or unverified theories about Qigong's effects, such as claims of instantaneous healing or supernatural abilities not supported by established Qigong theory or scientific consensus, where applicable within the regulatory scope, would be a significant regulatory and ethical failure. This constitutes unsubstantiated practice and could mislead clients, violating principles of honesty and client welfare. An approach that prioritizes anecdotal evidence over established theoretical principles, presenting personal testimonials as the primary basis for Qigong's effectiveness without reference to its theoretical underpinnings, is also professionally unsound. While testimonials can be illustrative, they do not replace the need for understanding the theoretical framework that explains why Qigong might be beneficial. This approach risks devaluing the theoretical foundations and promoting a practice based on hearsay rather than informed understanding, which is contrary to the standards expected of a certified Qigong instructor. Professional reasoning. Professionals should approach teaching Qigong by first establishing a strong understanding of its theoretical foundations, including concepts of Qi, meridians, and the energetic balance of the body. In teaching, they should integrate these theoretical explanations with the physical practice, ensuring that students understand the why behind the what. This involves referencing established Qigong principles and frameworks relevant to the certification. Decision-making should be guided by a commitment to accurate representation, client safety, and ethical practice, always prioritizing established knowledge and avoiding unsubstantiated claims. When faced with ambiguity, seeking clarification from regulatory bodies or experienced mentors within the certified framework is crucial. Question 2. The investigation demonstrates that a certified Qigong instructor is guiding a client through a series of postures designed to promote circulation and alleviate joint stiffness. The client expresses discomfort with a specific movement, stating it exacerbates a pre-existing knee issue, and requests a significant alteration to the posture that deviates from the traditional form. What is the most professionally responsible course of action for the instructor? Option A. Assess the client's knee, explain the biomechanical reasons for the discomfort in the original posture, and offer a modified version of the movement that maintains the core energetic principles while accommodating the client's limitation. Option B. Insist that the client perform the posture exactly as taught, explaining that adherence to the traditional form is paramount for achieving Qigong's benefits, and disregard the client's expressed discomfort. Option C. Immediately agree to the client's requested alteration to avoid conflict and ensure client satisfaction, even if it significantly changes the intended therapeutic effect of the movement. Option D. Suggest a completely unrelated set of exercises that do not involve the problematic posture, without attempting to understand or address the client's specific needs within the Qigong framework. The correct answer is A. Assess the client's knee, explain the biomechanical reasons for the discomfort in the original posture, and offer a modified version of the movement that maintains the core energetic principles while accommodating the client's limitation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified Qigong instructor to balance the client's perceived needs and preferences with the established principles of Qigong practice, and the instructor's professional responsibility to provide safe and effective instruction. The instructor must navigate potential client dissatisfaction while upholding their duty of care and adhering to professional standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and the integrity of Qigong principles by explaining the rationale behind specific posture modifications and offering alternatives that align with the client's physical limitations while still achieving the intended energetic and therapeutic benefits of the movement. The instructor demonstrates a commitment to personalized, informed, and ethical instruction. This approach respects the client's autonomy while ensuring their well-being and the efficacy of the practice, aligning with the core tenets of responsible Qigong instruction. Incorrect approach is analysis. One incorrect approach involves immediately agreeing to the client's request for a modified posture without proper assessment or explanation. This fails to uphold the instructor's professional responsibility to ensure the safety and effectiveness of the practice. It could lead to the client performing a movement that is not therapeutically beneficial or, worse, could exacerbate their existing condition or cause new injury. This approach bypasses the crucial step of professional judgment and informed consent regarding modifications. Another incorrect approach is to dismiss the client's request outright and insist on the original posture, without any attempt to understand their discomfort or offer alternatives. This demonstrates a lack of empathy and a failure to adapt instruction to individual needs, which is a cornerstone of effective teaching. It can alienate the client, damage the instructor-client relationship, and potentially lead to the client abandoning the practice altogether, missing out on its benefits. This approach neglects the client-centered aspect of instruction. A further incorrect approach might involve making a modification that deviates significantly from the fundamental principles of the Qigong form, even if it seems to alleviate the client's immediate discomfort. This risks undermining the integrity of the Qigong practice itself and may not achieve the intended energetic or therapeutic outcomes. It suggests a lack of understanding of the deeper purpose of the postures and movements, prioritizing superficial comfort over holistic benefit. Professional reasoning. Professionals in this field should employ a decision-making process that begins with active listening and empathetic understanding of the client's concerns. This should be followed by a thorough assessment of the client's physical condition and the specific posture in question. The instructor must then draw upon their knowledge of Qigong principles and anatomy to determine if a modification is necessary and safe. If a modification is appropriate, the instructor should clearly explain the rationale to the client, offer suitable alternatives, and ensure the client understands the purpose and execution of the modified movement. This process emphasizes informed consent, client safety, and the preservation of the integrity of the practice. Question 3. Upon reviewing the profiles of a new cohort of students for an upcoming certified Qigong instructor course, you notice a wide range of reported physical fitness levels and prior experience with mindful movement practices, from complete beginners to individuals with some background in yoga and Tai Chi. Your initial lesson plan focuses on introducing fundamental Qigong principles. How should you best structure the introductory session to effectively and safely engage all students? Option A. Focus exclusively on static standing meditation and deep breathing techniques, deeming dynamic movements too advanced for an initial session. Option B. Immediately introduce a series of complex, flowing dynamic Qigong forms to challenge all students and showcase the full spectrum of the practice. Option C. Begin with foundational static postures and breathwork exercises, gradually introducing simple dynamic movements as students demonstrate understanding and comfort. Option D. Deliver a standardized lesson plan that assumes a uniform level of physical ability and prior knowledge across all participants. The correct answer is C. Begin with foundational static postures and breathwork exercises, gradually introducing simple dynamic movements as students demonstrate understanding and comfort. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified Qigong instructor to adapt their teaching methodology to meet the diverse needs and physical capabilities of a new group of students. Without a thorough assessment, the instructor risks either overwhelming beginners with complex movements or under-challenging those with prior experience, potentially leading to disengagement or injury. The core challenge lies in balancing the foundational principles of Qigong with practical application for a varied audience. Correct approach analysis. The correct approach represents best professional practice because it prioritizes student safety, efficacy, and adherence to the ethical guidelines of the Certified Qigong Instructor Framework. This involves a proactive assessment of student capabilities and a tailored approach to instruction. By starting with foundational static postures and breathwork, the instructor establishes a solid base for all students, ensuring they understand core principles before progressing to dynamic movements. This aligns with the principle of do no harm and promotes gradual, safe learning, which is paramount in Qigong instruction. The framework implicitly supports a progressive teaching style that respects individual learning curves. Incorrect approaches analysis. One incorrect approach fails by immediately launching into complex dynamic forms without assessing the student's experience or physical condition. This poses a significant risk of injury, particularly for beginners, and violates the ethical responsibility of an instructor to ensure student safety. Disregards the foundational principles of Qigong, which often begin with stillness and mindful awareness. Another incorrect approach is to exclusively focus on static postures, neglecting the dynamic aspects of Qigong. While static postures are crucial for building internal awareness and energy, Qigong is inherently a practice that integrates movement and stillness. Failing to introduce dynamic forms limits the student's comprehensive understanding and experience of Qigong, potentially falling short of the expected scope of instruction for a certified Qigong instructor. A further incorrect approach involves assuming all students have a similar level of understanding and physical ability, leading to a one-size-fits-all lesson plan. This overlooks the diversity within any group and can lead to frustration for those who are struggling or boredom for those who are more advanced. It demonstrates a lack of professional due diligence in understanding the audience. Professional reasoning. Professionals should employ a systematic approach that begins with understanding their audience. This involves active listening, observation, and, where appropriate, direct questioning to gauge experience levels, physical limitations, and learning goals. The instructor should then design a curriculum that is adaptable, offering modifications and progressions. The decision-making process should always prioritize safety, ethical conduct, and the effective transmission of knowledge and practice, ensuring that the chosen Qigong methods are appropriate for the specific group being taught. Question 4. Operational review demonstrates a client seeking instruction in a specific Qigong form they believe will alleviate chronic back pain, for which they are currently receiving physical therapy. The certified Qigong instructor is aware that certain Qigong movements could potentially aggravate spinal conditions if not performed correctly or if the condition is severe. What is the most appropriate course of action for the instructor to ensure client safety and adhere to professional standards? Option A. Recommend the client obtain medical clearance from their physician or physical therapist regarding the suitability of Qigong for their specific condition before proceeding with any instruction, and then adapt the practice based on that clearance. Option B. Advise the client that Qigong is not a recognized treatment for chronic back pain and refuse to offer any instruction related to their condition. Option C. Assure the client that the specific Qigong form they requested is a proven cure for chronic back pain and proceed with teaching it as a primary treatment. Option D. Immediately begin teaching the requested Qigong form, assuming that any Qigong practice is beneficial for pain management and that the client's desire indicates its appropriateness. The correct answer is A. Recommend the client obtain medical clearance from their physician or physical therapist regarding the suitability of Qigong for their specific condition before proceeding with any instruction, and then adapt the practice based on that clearance. Explanation. This scenario presents a professional challenge because a certified Qigong instructor must balance the client's expressed desire for a specific pain management technique with their ethical and regulatory obligations to provide safe and appropriate instruction. The instructor must assess the client's condition, understand the limitations of Qigong for certain types of pain, and ensure that the proposed Qigong practice does not exacerbate the client's existing medical condition or contraindicate their prescribed medical treatment. The regulatory framework for certified Qigong instructors emphasizes client safety, scope of practice, and the avoidance of making unsubstantiated medical claims. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's pain, including consultation with their healthcare provider. This aligns with the regulatory requirement to operate within one's scope of practice and to ensure that Qigong instruction is complementary to, rather than a replacement for, conventional medical care. By seeking medical clearance and understanding the specific nature of the client's pain, the instructor can tailor Qigong practices safely and effectively, adhering to ethical guidelines that prevent harm and promote well-being. This also demonstrates a commitment to evidence-informed practice and interdisciplinary collaboration, which are implicitly encouraged by regulatory bodies focused on professional standards. An incorrect approach that involves immediately implementing the client's requested Qigong technique without further assessment or medical consultation is professionally unacceptable. This fails to meet the regulatory obligation to ensure client safety and could lead to harm if the Qigong practice is inappropriate for the client's specific condition. It also oversteps the instructor's scope of practice by assuming Qigong alone can manage a diagnosed medical condition without understanding its underlying cause or potential contraindications. Another incorrect approach, which involves dismissing the client's request and refusing to offer any Qigong assistance for pain management, is also professionally deficient. A caution is necessary. A complete refusal without exploring safe, modified Qigong options or providing general well-being practices that are known to be beneficial for pain management, e.g., gentle movement, breathwork, may not fully serve the client's needs and could be seen as a failure to apply their certified skills appropriately within safe boundaries. This approach lacks the nuanced judgment required to balance safety with client support. A third incorrect approach, which involves making definitive claims about Qigong's ability to cure the client's specific pain condition, is a direct violation of regulatory guidelines against unsubstantiated medical claims. Certified instructors are expected to present Qigong as a complementary practice that can support well-being and potentially alleviate symptoms, not as a standalone cure for diagnosed medical issues. This approach erodes trust and can mislead clients about the efficacy and role of Qigong in their overall health management. The professional decision-making process for similar situations should involve a structured approach. 1. Client intake and assessment. Gather detailed information about the client's health history, current symptoms, and any existing medical conditions or treatments. 2. Scope of practice evaluation. Determine if the client's request falls within the certified Qigong instructor's scope of practice. 3. Medical consultation. If the client presents with a diagnosed medical condition or significant pain, strongly recommend, and if possible, facilitate consultation with their healthcare provider to obtain clearance and understand any limitations or contraindications. 4. Tailored instruction. Based on the assessment and medical advice, design or adapt Qigong practices that are safe, appropriate, and complementary to the client's overall health plan. 5. Clear communication. Educate the client about the role of Qigong, its potential benefits, and its limitations, ensuring they understand it is not a substitute for medical treatment. 6. Ongoing monitoring. Regularly check in with the client to assess their response to the Qigong practice and make adjustments as needed, always prioritizing their safety and well-being. Question 5. Examination of the data shows that a certified Qigong instructor is preparing to teach a new class on the fundamental principles of Qigong. A key element of this introductory lesson is explaining the concept of Qi energy, considering the regulatory framework and ethical guidelines for certified Qigong instructors. Which approach to explaining Qi would be most appropriate and professionally sound? Option A. Explain Qi as the vital life force or energy that is cultivated and directed through Qigong practices, focusing on its role in promoting health and well-being, and acknowledging its basis in traditional understanding and experiential practice. Option B. Define Qi as a mystical energy that can only be accessed and understood through advanced spiritual disciplines and requires a guru's direct transmission for true comprehension. Option C. Present Qi as a purely metaphorical concept, emphasizing that it is a symbolic representation of internal processes rather than an actual energetic force that can be manipulated. Option D. Describe Qi as a scientifically proven, measurable bioelectrical current that directly correlates with specific physiological markers, citing peer-reviewed studies that definitively prove its existence and function. The correct answer is A. Explain Qi as the vital life force or energy that is cultivated and directed through Qigong practices, focusing on its role in promoting health and well-being, and acknowledging its basis in traditional understanding and experiential practice. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified Qigong instructor to balance the theoretical understanding of Qi with the practical application and communication of this concept to diverse individuals. The instructor must ensure that their explanations are accurate, ethical, and align with the established understanding of Qi within the Qigong framework, while also being accessible and beneficial to students. Misrepresenting or oversimplifying the concept of Qi can lead to student misunderstanding, potential harm, or a diminished appreciation for the practice. Correct approach analysis. The correct approach represents best professional practice because it emphasizes a nuanced and evidence-informed understanding of Qi as a foundational concept in Qigong. It acknowledges Qi as a vital life force or energy that is cultivated and directed through Qigong practices, aligning with the core principles of Qigong as understood within its traditional and contemporary frameworks. This approach promotes accurate education, fosters student trust, and upholds the integrity of the Qigong discipline. It avoids unsubstantiated claims and focuses on the observable effects and energetic principles that are central to Qigong's efficacy. Incorrect approaches analysis. One incorrect approach fails by presenting Qi as a scientifically proven, measurable entity in the same way as Western biomedical concepts. This is a regulatory and ethical failure because it misrepresents the current scientific consensus and the nature of Qi as understood within Qigong, which is primarily a concept rooted in traditional philosophy and experiential practice. It can lead to false expectations and a misunderstanding of Qigong's scope. Another incorrect approach errs by dismissing Qi as purely metaphorical or symbolic, devoid of any energetic reality. This is an ethical failure, as it undermines the foundational principles of Qigong, potentially alienating students who are seeking to understand and work with this energetic concept. It also fails to acknowledge the experiential and energetic shifts that many practitioners report, which are central to the Qigong tradition. A further incorrect approach is to present Qi as a mystical force that can only be understood through esoteric initiation. This is a regulatory and ethical failure because it creates an exclusionary barrier to learning and misrepresents Qigong as being accessible only to a select few. Certified Qigong instructors have a responsibility to make the practice and its core concepts accessible and understandable to all students, within appropriate ethical boundaries. Professional reasoning. Professionals should approach the explanation of Qi by grounding it in the established principles of Qigong, acknowledging its role as a vital energy or life force that is cultivated and directed through practice. They should use clear, accessible language, avoiding jargon where possible, and relate the concept to observable physiological and psychological effects. When discussing Qi, instructors should be mindful of the distinction between traditional understanding and current scientific validation, focusing on the practical benefits and energetic principles that are central to Qigong's efficacy. They should also be prepared to answer student questions with honesty and clarity, respecting the diverse backgrounds and beliefs of their students. Question 6. Performance analysis shows that a certified Qigong instructor is tasked with optimizing the standing meditation, Zhan Zhuang, practice for a new cohort of students with varying levels of physical fitness and prior experience. Which of the following approaches best facilitates safe and effective process optimization for this group? Option A. Encouraging students to explore variations and modifications based on their individual comfort and physical limitations, with a focus on gradual progression and mindful awareness of bodily sensations. Option B. Focusing exclusively on the external form of the posture, neglecting to address internal awareness, breath integration, or individual student feedback. Option C. Prioritizing rapid progression to deeper energetic states by instructing students to ignore minor physical discomfort and push through perceived limitations. Option D. Implementing a standardized, one-size-fits-all posture and duration for all students, emphasizing the most advanced energetic outcomes from the outset. The correct answer is D. Implementing a standardized, one-size-fits-all posture and duration for all students, emphasizing the most advanced energetic outcomes from the outset. Explanation. This scenario presents a professional challenge for a certified Qigong instructor by requiring them to optimize a core practice, standing meditation, Zhanzhuang, for a diverse group of students. The challenge lies in balancing the fundamental principles of Zhanzhuang with the varied physical capabilities, prior experiences, and potential health concerns of individuals, all while adhering to the ethical and professional standards expected of a certified instructor. Careful judgment is required to ensure safety, efficacy, and inclusivity. The correct approach represents best professional practice because it prioritizes a holistic, individualized, and safety-conscious method of process optimization. This aligns with the ethical duty of care inherent in teaching any physical discipline, especially one that can have profound physical and energetic effects. By focusing on gradual progression, mindful adaptation, and clear communication of potential contraindications, the instructor ensures that the practice is accessible and beneficial to all students, minimizing the risk of injury or adverse effects. This approach is implicitly supported by the general principles of responsible instruction and client well-being, which are foundational to professional certification. An incorrect approach that focuses solely on achieving a specific aesthetic or energetic outcome without regard for individual student capacity is professionally unacceptable. This could lead to students pushing beyond their limits, resulting in physical strain, injury, or discouragement, thereby failing the duty of care. Another incorrect approach that neglects to address potential health concerns or modifications for students with pre-existing conditions is also ethically flawed. It demonstrates a lack of due diligence and could inadvertently exacerbate existing health issues, violating the principle of do no harm. Furthermore, an approach that emphasizes rapid or forceful energetic manipulation without proper grounding or student readiness is risky and unprofessional, potentially leading to energetic imbalances or distress. The professional decision-making process for similar situations should involve a thorough initial assessment of each student's physical condition and experience level. This should be followed by clear instruction on the foundational principles of Zhanzhuang, emphasizing proper alignment, relaxation, and breath awareness. The instructor must then continuously observe students during practice, offering personalized adjustments and modifications as needed. Open communication channels are crucial, encouraging students to report any discomfort or unusual sensations. Finally, the optimization process should be iterative, with feedback from students and ongoing self-reflection by the instructor to refine teaching methods and ensure the practice remains safe, effective, and appropriate for the entire group. Question 7. Compliance review shows that a certified Qigong instructor is preparing an introductory session for new students. The instructor needs to define Qigong and provide a brief historical overview, which approach best adheres to the principles of accurate and ethical instruction regarding the definition and history of Qigong. Option A. Emphasize Qigong's ancient Chinese origins, its development over centuries as a system for cultivating vital energy, Qi, through mind-body practices like movement, breathwork, and meditation, and its recognized benefits for physical and mental well-being. Option B. Present Qigong as a practice exclusively focused on achieving supernatural abilities, with its history rooted in ancient Taoist alchemy and shamanic rituals. Option C. Define Qigong as a singular, unchanging practice attributed to a single historical master from the Tang dynasty, with no significant evolution or regional variations. Option D. Describe Qigong as a relatively recent innovation, primarily developed in the late 20th century as a form of aerobic exercise and stress reduction. The correct answer is A. Emphasize Qigong's ancient Chinese origins, its development over centuries as a system for cultivating vital energy, Qi, through mind-body practices like movement, breathwork, and meditation, and its recognized benefits for physical and mental well-being. Explanation. Scenario analysis. This scenario presents a challenge in accurately representing the historical development and foundational principles of Qigong to new students. The instructor must balance providing a comprehensive overview with the need for clarity and accessibility, ensuring that the information presented is both historically grounded and ethically sound in its portrayal. Misrepresenting the history or definition can lead to a misunderstanding of Qigong's purpose, efficacy, and its place within broader health and wellness practices, potentially impacting student trust and the integrity of the instruction. Correct approach analysis. The correct approach involves presenting Qigong as a multifaceted practice with roots in ancient Chinese culture, encompassing mind-body integration, breathwork, and gentle movement for health and spiritual development. This aligns with the generally accepted historical and definitional understanding of Qigong, emphasizing its long lineage and diverse applications. Adhering to this approach ensures that students receive accurate foundational knowledge, respecting the tradition and its evolution. This is ethically sound as it promotes truthfulness and avoids misleading students about the origins and nature of the practice they are learning. Incorrect approaches analysis. Presenting Qigong solely as a modern invention for physical fitness overlooks its deeper historical and philosophical dimensions, failing to acknowledge its ancient origins and its broader scope beyond mere exercise. This is a misrepresentation of its definition and history, attributing Qigong exclusively to a single, specific historical figure or dynasty without acknowledging its gradual development and diverse regional influences is an oversimplification that distorts its historical trajectory. This is factually inaccurate and ethically misleading, describing Qigong as a purely spiritual or mystical practice, devoid of its established health and wellness application, creates an incomplete and potentially alienating picture for students seeking practical benefits. This misrepresents the comprehensive definition and historical use of Qigong. Professional reasoning. Professionals in this field should approach the definition and history of Qigong with a commitment to accuracy and completeness. This involves consulting reputable historical sources, understanding the evolution of the practice, and presenting information in a way that is both informative and accessible. When faced with potential oversimplifications or misrepresentations, the professional decision-making process should prioritize factual integrity and ethical communication, ensuring that students receive a well-rounded and truthful introduction to Qigong. Question 8. Analysis of how a certified Qigong instructor should communicate the physical health benefits of Qigong practice to clients, considering the potential for misinterpretation and the need for ethical and regulatory compliance. Option A. Promote Qigong as a direct treatment and cure for chronic diseases such as arthritis and hypertension, citing personal success stories as primary evidence of its efficacy. Option B. Emphasize that Qigong can be a complementary practice for general well-being, stress reduction, and improved physical function, while advising clients to consult with healthcare professionals for specific medical conditions. Option C. Present Qigong as a powerful alternative to conventional medicine, suggesting that consistent practice can replace the need for doctor visits and prescribed medications for most ailments. Option D. Focus exclusively on the spiritual and energetic aspects of Qigong, downplaying any potential physical health benefits to avoid making any health-related claims. The correct answer is B. Emphasize that Qigong can be a complementary practice for general well-being, stress reduction, and improved physical function, while advising clients to consult with healthcare professionals for specific medical conditions. Explanation. This scenario presents a professional challenge for a certified Qigong instructor because it requires them to balance the promotion of Qigong's physical health benefits with the ethical and regulatory imperative to avoid making unsubstantiated medical claims. The instructor must understand the scope of their practice, which is to guide Qigong exercises for general well-being, not to diagnose, treat, or cure specific medical conditions. This requires careful communication and a commitment to evidence-based practice within the bounds of their certification. The correct approach represents best professional practice because it aligns with the principles of responsible health promotion and adheres to the likely regulatory framework governing health and wellness practitioners. By focusing on general well-being, stress reduction, and improved physical function, the instructor stays within their scope of practice. This approach is ethically sound as it avoids misleading clients about the efficacy of Qigong for specific ailments and respects the client's autonomy to seek appropriate medical care. It also implicitly acknowledges that while Qigong may offer complementary benefits, it is not a substitute for conventional medical treatment. An incorrect approach that suggests Qigong can cure specific diseases like diabetes or heart conditions represents a significant regulatory and ethical failure. This constitutes making unsubstantiated medical claims, which is often prohibited by professional bodies and consumer protection laws. Such claims can mislead individuals into foregoing or delaying necessary medical treatment, potentially leading to adverse health outcomes. Ethically, it breaches the duty of care owed to clients by providing potentially false hope and inaccurate information. Another incorrect approach that focuses solely on anecdotal evidence without acknowledging the need for broader scientific validation also falls short. While personal testimonials can be motivating, professional practice demands a more rigorous understanding of evidence and a cautious approach to claims, especially when health is concerned. This can lead to overpromising and underdelivering, eroding trust and potentially violating guidelines that emphasize evidence-informed practice. The professional decision-making process for similar situations should involve a clear understanding of the instructor's scope of practice as defined by their certification and any relevant professional guidelines. When communicating potential benefits, instructors should always frame them in terms of general well-being, improved physical function, and stress management, rather than specific disease treatment or cure. They should encourage clients to consult with qualified healthcare professionals for any medical concerns. A commitment to continuous learning about the scientific literature on Qigong's effects, while maintaining a critical perspective, is also crucial. When in doubt about the appropriateness of a claim, the safest and most ethical course of action is to err on the side of caution and avoid making definitive statements about medical outcomes. Question 9. Strategic planning requires a certified Qigong instructor to consider how best to impart the principles of Qigong to a diverse group of learners. Which of the following approaches best reflects effective and ethical teaching practices for a certified Qigong instructor? Option A. Prioritize the demonstration of intricate physical forms over explaining the underlying energetic principles and mindful awareness components of Qigong. Option B. Focus primarily on the complex, advanced theoretical aspects of Qigong, assuming students will grasp the practical applications through osmosis. Option C. Implement a standardized teaching methodology that ensures all students receive the exact same instruction, regardless of their background or learning pace. Option D. Develop a teaching plan that emphasizes understanding individual student needs and adapting instruction to facilitate their progress and safety, while providing clear, constructive feedback. The correct answer is D. Develop a teaching plan that emphasizes understanding individual student needs and adapting instruction to facilitate their progress and safety, while providing clear, constructive feedback. Explanation. Scenario analysis. This scenario is professionally challenging because a certified Qigong instructor must balance the inherent flexibility and experiential nature of Qigong practice with the need for structured, safe, and effective instruction. The instructor must consider the diverse needs and backgrounds of students, ensuring that the principles of teaching Qigong are applied in a way that is both accessible and beneficial, while adhering to the ethical guidelines and professional standards expected of a certified instructor. The challenge lies in translating the subtle nuances of Qigong into clear, actionable teaching methods that promote student progress and well-being, without compromising the integrity of the practice or the instructor's professional responsibilities. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a student-centered methodology that integrates foundational Qigong principles with adaptive teaching strategies. This approach acknowledges that effective Qigong instruction is not a one-size-fits-all model. By focusing on understanding individual student needs, adapting instruction accordingly, and providing clear, constructive feedback, the instructor fosters a supportive learning environment. This aligns with the ethical imperative to promote student safety, progress, and a positive experience, which are core tenets of professional Qigong instruction. It emphasizes the instructor's role as a facilitator of learning, guiding students to develop their own understanding and practice. Incorrect approaches analysis. One incorrect approach fails to acknowledge the importance of individual student differences, attempting to apply a rigid, uniform teaching method to all students regardless of their experience, physical condition, or learning style. This approach is ethically flawed as it neglects the instructor's duty of care to adapt instruction to meet diverse needs, potentially leading to student frustration, injury, or a lack of progress. It also fails to uphold the professional standard of individualized instruction. Another incorrect approach prioritizes the instructor's personal interpretation or advanced understanding of Qigong over the foundational principles of effective pedagogy. This can result in instruction that is overly complex, abstract, or disconnected from the practical needs of beginners. Ethically, this approach can be seen as a failure to adequately guide and support students, potentially overwhelming them or leading them down an unproductive path. It also undermines the professional responsibility to teach in a clear and accessible manner. A third incorrect approach focuses solely on the physical movements of Qigong, neglecting the crucial energetic and mental components that are integral to the practice. This reductionist view can lead to superficial instruction that does not fully convey the depth and benefits of Qigong. Ethically, this is a failure to provide comprehensive instruction, potentially limiting the student's understanding and experience of Qigong. It also falls short of the professional standard of teaching Qigong in its holistic form. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the learning context and student population. This involves understanding the learning objectives, the student's prior knowledge and experience, and any specific needs or limitations. The instructor should then select teaching methods that are evidence-based and aligned with the core principles of Qigong, while remaining flexible enough to adapt to individual and group responses. Continuous evaluation of the teaching process and student progress is essential, allowing for adjustments to be made in real time. This iterative process ensures that instruction remains effective, safe, and ethically sound, fostering a positive and productive learning environment that upholds the highest professional standards. Question 10. The risk matrix shows a moderate likelihood of client misunderstanding regarding the therapeutic claims of sound healing integrated into Qigong sessions. As a certified Qigong instructor, what is the most responsible and ethically compliant approach to address this risk? Option A. State that sound healing is a form of alternative medicine that can replace conventional medical treatments for many conditions, and encourage clients to discontinue their prescribed medical therapies. Option B. Clearly articulate that sound healing is a complementary modality for promoting relaxation and well-being, not a treatment for specific medical conditions, and advise clients with pre-existing health concerns to consult their healthcare providers before participating. Option C. Promote sound healing as a powerful tool capable of directly addressing and resolving various physical and emotional ailments, encouraging clients to rely on it as a primary method of healing. Option D. Integrate sound healing without explicit explanation, assuming clients will understand its purpose within the broader context of Qigong practice. The correct answer is B. Clearly articulate that sound healing is a complementary modality for promoting relaxation and well-being, not a treatment for specific medical conditions, and advise clients with pre-existing health concerns to consult their healthcare providers before participating. Explanation. This scenario presents a professional challenge for a certified Qigong instructor regarding the integration of sound healing practices within their Qigong instruction. The core challenge lies in balancing the therapeutic potential of sound with the need for responsible, evidence-informed, and ethically sound practice, particularly when clients may have pre-existing health conditions or expectations of medical treatment. The instructor must navigate the fine line between complementary wellness practices and the unauthorized practice of medicine. The correct approach represents best professional practice because it prioritizes client safety, informed consent, and scope of practice limitations. By clearly defining sound healing as a complementary modality, emphasizing its non-medical nature, and requiring clients to consult with healthcare professionals for medical concerns, the instructor adheres to ethical guidelines and avoids misrepresenting the services offered. This approach aligns with the principle of do no harm and upholds the integrity of Qigong instruction as a wellness practice, not a substitute for medical care. It also respects the client's autonomy by ensuring they understand the nature of the intervention and its limitations. An incorrect approach that suggests sound healing can directly treat specific medical conditions is a significant regulatory and ethical failure. This misrepresents the scope of practice for a Qigong instructor, potentially leading clients to forego or delay necessary medical treatment, which could have serious health consequences. This constitutes the unauthorized practice of medicine, a violation of professional standards and potentially legal statutes. Another incorrect approach that fails to obtain informed consent regarding the nature and limitations of sound healing is also ethically problematic. Clients must understand what they are engaging in and what outcomes can reasonably be expected. Without this, there is a risk of misinterpretation and unmet expectations, undermining trust and professional credibility. A third incorrect approach that neglects to advise clients with pre-existing conditions to consult their healthcare providers before participating in sound healing is a failure to exercise due diligence and prioritize client safety. This oversight can lead to adverse reactions or complications, for which the instructor could be held responsible. The professional decision-making process for similar situations should involve a thorough understanding of one's scope of practice as a certified Qigong instructor. This includes recognizing the boundaries between wellness practices and medical treatment. When integrating complementary modalities like sound healing, instructors must prioritize client well-being by ensuring clear communication, obtaining informed consent, and always recommending that clients consult with qualified healthcare professionals for any medical concerns or conditions. A risk assessment should be conducted for any new modality, considering potential contraindications and the need for appropriate disclaimers. Ethical guidelines and any applicable regulatory frameworks for wellness practitioners should be consulted to ensure all practices are compliant and responsible. Question 11. Research into effective teaching methodologies for certified Qigong instructors reveals varying approaches to instruction. Considering a class with a mix of absolute beginners and individuals with some prior experience in movement arts, which teaching methodology best aligns with the professional standards and ethical considerations for a certified Qigong instructor? Option A. A methodology that prioritizes the historical lineage and philosophical underpinnings of Qigong, with minimal emphasis on physical demonstration or adaptation. Option B. A methodology that begins with foundational principles and basic movements, progressively introducing more complex forms while offering clear modifications for varying physical abilities and encouraging students to listen to their bodies. Option C. A methodology that focuses exclusively on the most advanced and intricate Qigong forms to challenge experienced practitioners and inspire beginners through demonstration of mastery. Option D. A methodology that employs a rapid-fire approach, teaching a wide variety of forms in a short period to expose students to the breadth of Qigong practices. The correct answer is B. A methodology that begins with foundational principles and basic movements, progressively introducing more complex forms while offering clear modifications for varying physical abilities and encouraging students to listen to their bodies. Explanation. This scenario presents a professional challenge due to the inherent diversity of student needs and learning styles within a Qigong class. Certified Qigong instructor must navigate this by employing adaptable teaching methodologies that cater to a broad spectrum of participants, from beginners to those with prior experience, and individuals with varying physical capabilities or health conditions. The instructor's responsibility extends beyond simply demonstrating movements. It involves creating an inclusive and effective learning environment that respects individual progress and promotes safe practice, all within the ethical guidelines of the Certified Qigong Instructor Framework. Careful judgment is required to balance the integrity of the Qigong practice with the practical needs of the students. The correct approach represents best professional practice because it prioritizes a student-centered methodology that integrates foundational Qigong principles with adaptive techniques. This aligns with the ethical imperative for instructors to ensure accessibility and safety for all participants. By offering modifications and encouraging self-awareness, the instructor fosters an environment where students can learn at their own pace and within their physical limits, thereby maximizing the benefits of Qigong practice. This approach upholds the professional standard of providing competent and responsible instruction, ensuring that the core essence of Qigong is conveyed effectively and safely to each individual. An incorrect approach that focuses solely on advanced techniques without providing foundational instruction fails to meet the needs of beginners and may lead to improper form and potential injury, violating the duty of care. Another incorrect approach that neglects to offer modifications for physical limitations or health concerns, creates an exclusionary environment, and disregards the diverse needs of the student population, contravening ethical principles of inclusivity and accessibility. A third incorrect approach that emphasizes rote memorization of forms over understanding the underlying principles of Kai cultivation and mindful movement misses the essence of Qigong practice, leading to superficial learning and potentially undermining the therapeutic and developmental goals of the discipline. Professionals should employ a decision-making framework that begins with a thorough assessment of the student group's general experience level and any known limitations. This is followed by the selection of core teaching methodologies that are adaptable. The instructor should then plan for progressive introduction of concepts and techniques, with built-in opportunities for observation, feedback, and modification. Continuous self-reflection on teaching effectiveness and student engagement is crucial, allowing for adjustments to be made in real time to best serve the learning objectives and well-being of all participants. Question 12. The assessment process reveals that a long-term client who has been practicing Qigong for immune system support has developed a persistent cough over the past 2 weeks. The client reports no other significant symptoms but expresses concern about the cough's duration. As a certified Qigong instructor, what is the most appropriate initial course of action regarding the client's cough? Option A. Suggest that the cough is a sign of energetic imbalance and recommend a more intensive Qigong routine to address the underlying Kai deficiency. Option B. Immediately prescribe a series of specific Qigong exercises designed to clear lung congestion and strengthen the respiratory system, assuming it is a common ailment. Option C. Downplay the cough as a minor issue and continue with the client's existing Qigong routine for immune support, assuming it will resolve on its own. Option D. Advise the client to consult with a qualified healthcare professional to investigate the cause of the cough and obtain medical clearance before continuing or modifying their Qigong practice. The correct answer is D. Advise the client to consult with a qualified healthcare professional to investigate the cause of the cough and obtain medical clearance before continuing or modifying their Qigong practice. Explanation. Scenario analysis. The scenario presents a certified Qigong instructor with a client experiencing a persistent cough, a symptom that could indicate a range of underlying health conditions, from minor respiratory irritation to more serious issues. The challenge lies in distinguishing between a common ailment that Qigong might support and a condition requiring medical intervention. The instructor must navigate the ethical and professional boundaries of their practice, ensuring client safety and adhering to their scope of practice without overstepping into medical diagnosis or treatment. This requires a robust risk assessment process. Correct approach analysis. The correct approach involves a thorough risk assessment that prioritizes client safety and adheres to the scope of practice for a certified Qigong instructor. This includes gathering detailed information about the cough's duration, severity, accompanying symptoms, and the client's medical history. Crucially, it involves advising the client to seek professional medical evaluation from a qualified healthcare provider to rule out any serious underlying conditions. This aligns with the ethical obligation to do no harm and the regulatory framework that mandates instructors operate within their defined competencies. Recommending Qigong practices after a medical clearance, or as a complementary approach alongside medical advice, is appropriate. This demonstrates a commitment to client well-being by ensuring that any Qigong intervention is safe and does not delay or interfere with necessary medical care. Incorrect approaches analysis. One incorrect approach involves immediately recommending specific Qigong exercises to alleviate the cough without first assessing the potential underlying cause or advising medical consultation. This is a regulatory and ethical failure because it constitutes practicing outside the scope of a Qigong instructor, potentially venturing into medical advice or treatment. It risks delaying necessary medical diagnosis and treatment, which could have serious consequences for the client's health. Another incorrect approach is to dismiss the cough as a minor issue and proceed with general Qigong practice without any specific inquiry into its nature or duration. This demonstrates a lack of due diligence and a failure to conduct a proper risk assessment. Ethically, it is irresponsible to ignore potentially significant health indicators. From a regulatory standpoint, it shows a disregard for client safety and the instructor's professional responsibilities. A third incorrect approach is to diagnose the cough as a specific condition, e.g., Kai stagnation in the lungs, and prescribe Qigong exercises to cure it. This is a severe breach of professional boundaries and regulatory guidelines. Certified Qigong instructors are not licensed medical professionals and are prohibited from diagnosing or treating medical conditions. Such an action constitutes practicing medicine without a license and poses a significant risk to the client. Professional reasoning. When faced with a client presenting with a new or persistent symptom like a cough, a certified Qigong instructor should employ a structured decision-making process. This begins with active listening and information gathering, focusing on the symptom's characteristics and the client's overall health. The next critical step is to assess the risk. Is this a symptom that requires immediate medical attention, or is it something that Qigong might safely complement? The guiding principle is always client safety and operating within one's scope of practice. Therefore, the default action for any persistent or concerning symptom should be to recommend consultation with a qualified healthcare professional. Only after medical clearance, or in conjunction with medical advice, should Qigong practices be considered as a supportive modality, tailored to the client's specific needs and limitations as determined by their medical provider. Question 13. Quality control measures reveal that a certified Qigong instructor, when introducing visualization techniques to a new group, immediately guides participants through an elaborate visualization of overcoming a significant personal obstacle, using vivid sensory details and emotionally evocative language. Following this, the instructor proceeds to the next exercise without checking for participant comprehension or emotional state. Which approach to introducing visualization techniques best aligns with the professional standards and ethical guidelines for a certified Qigong instructor? Option A. Immediately guide participants through complex, emotionally charged visualizations to maximize the potential for profound personal insight and transformation from the outset. Option B. Begin with simple, universally accessible imagery, gradually increasing complexity and emotional depth based on participant feedback and observed responses, while ensuring a safe and supportive environment. Option C. Dismiss any participant feedback that suggests discomfort or difficulty with a visualization, attributing it to a lack of commitment or imagination. Option D. Insist on a single, highly specific visualization technique that the instructor has found most effective, expecting all participants to adapt to it. The correct answer is B. Begin with simple, universally accessible imagery, gradually increasing complexity and emotional depth based on participant feedback and observed responses, while ensuring a safe and supportive environment. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified Qigong instructor regarding the application of visualization techniques within a group setting. The challenge lies in balancing the instructor's expertise and the potential benefits of visualization with the diverse needs, sensitivities, and potential psychological responses of participants. Ensuring that visualization practices are inclusive, safe, and ethically delivered requires careful consideration of individual differences and adherence to professional standards. Correct approach analysis. The correct approach emphasizes a gradual, inclusive, and adaptable introduction to visualization, prioritizing participant comfort and awareness. This aligns with the ethical guidelines for certified Qigong instructors, which mandate a duty of care, informed consent, and the avoidance of harm. By starting with simple, universally accessible imagery and progressively introducing more complex visualizations based on group feedback and observed responses, the instructor demonstrates a commitment to participant well-being and professional responsibility. This approach respects individual differences in imaginative capacity and emotional response, ensuring that no participant feels pressured or alienated. It also allows for real-time adjustments to the practice, a hallmark of skilled instruction. Incorrect approaches analysis. One incorrect approach involves immediately introducing highly specific and emotionally charged visualizations without prior assessment or gradual introduction. This fails to acknowledge the potential for such imagery to evoke distress or discomfort in individuals with past traumas or specific sensitivities, violating the duty of care and potentially causing harm. It also bypasses the principle of informed consent by not adequately preparing participants for the nature of the visualization. Another incorrect approach is to dismiss or ignore participant feedback regarding the effectiveness or comfort of a particular visualization. This demonstrates a lack of responsiveness and a failure to adapt teaching methods to the needs of the group, which is contrary to best practices in client-centered instruction. Ethically, it can lead to a breakdown of trust and a perception that the instructor is not genuinely invested in the participant's experience. A further incorrect approach is to insist on a single, prescribed visualization technique for all participants, regardless of their individual experiences or preferences. This rigid adherence to a specific method, without offering alternatives or modifications, can exclude individuals who may not resonate with that particular imagery or who find it challenging to engage with. This contravenes the principle of inclusivity and can be seen as a failure to provide appropriate instruction tailored to the group's diverse needs. Professional reasoning. Certified Qigong instructors must employ a decision-making process that prioritizes participant safety, ethical conduct, and effective instruction. This involves 1. Thoroughly understanding the principles and potential applications of visualization techniques. 2. Assessing the group's general experience level and any disclosed sensitivities while respecting privacy. 3. Introducing techniques gradually, starting with simpler, more universally relatable imagery. 4. Continuously observing participant responses and actively soliciting feedback. 5. Being prepared to modify, adapt, or offer alternative visualization approaches based on feedback and observed needs. 6. Maintaining a commitment to ongoing professional development to refine teaching methodologies and deepen understanding of participant psychology within the context of Qigong practice. Question 14. Which approach would be most appropriate for a certified Qigong instructor to employ when guiding a client in enhancing their flexibility and balance? Option A. A regimen of rapid, forceful Qigong movements designed to quickly increase range of motion, with minimal emphasis on breath control or internal energy cultivation. Option B. The application of specific therapeutic exercises derived from Western physical therapy modalities, targeting areas of perceived stiffness or imbalance, without prior medical consultation. Option C. A gradual integration of foundational Qigong movements, focusing on mindful breath synchronization and progressive postural refinement, tailored to the client's individual physical condition and experience level. Option D. The immediate introduction of complex and advanced Qigong postures known for their significant impact on flexibility, assuming the client's desire for rapid improvement. The correct answer is C. A gradual integration of foundational Qigong movements, focusing on mindful breath synchronization and progressive postural refinement, tailored to the client's individual physical condition and experience level. Explanation. This scenario presents a professional challenge for a certified Qigong instructor by requiring them to select the most effective and ethically sound method for enhancing a client's flexibility and balance, while adhering to the specific regulatory framework of the Certified Qigong Instructor exam. The challenge lies in discerning between approaches that are purely theoretical, potentially unsafe without proper qualification, or that overstep the scope of practice for a Qigong instructor. Careful judgment is required to ensure client safety, efficacy of instruction, and compliance with professional standards. The correct approach represents best professional practice because it prioritizes a holistic, client-centered methodology that is directly aligned with the principles of Qigong. This approach emphasizes gradual progression, mindful movement, and personalized adaptation, which are fundamental to safe and effective Qigong instruction. It also implicitly acknowledges the instructor's scope of practice by focusing on techniques within Qigong's purview, rather than venturing into areas requiring specialized medical or therapeutic credentials. This aligns with the ethical obligation to provide competent instruction and to avoid practicing outside one's expertise, a core tenet for certified instructors. An incorrect approach that relies solely on advanced, potentially strenuous postures, without considering the client's current physical condition or prior experience, would represent a significant regulatory and ethical failure. This could lead to injury, violating the duty of care owed to the client. Another incorrect approach that involves prescribing specific therapeutic exercises for a diagnosed medical condition would also be a failure, as it constitutes practicing medicine or physical therapy without the necessary licensure and qualifications, directly contravening the scope of practice for a Qigong instructor. Furthermore, an approach that focuses exclusively on rapid, forceful movements without emphasizing breath control and internal awareness would deviate from the core principles of Qigong, potentially leading to ineffectiveness and misrepresentation of the practice. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's current physical capabilities, limitations, and goals. This assessment should inform the selection of Qigong techniques, prioritizing safety and gradual progression. Instructors must continuously monitor client response and adapt their instruction accordingly. They should also be aware of their scope of practice, referring clients to other qualified professionals when their needs fall outside the instructor's expertise. Adherence to the specific regulatory guidelines for certified Qigong instructors, focusing on ethical conduct and competent instruction, is paramount. Question 15. The review process indicates that a certified Qigong instructor is developing a personalized Qigong program for a client experiencing chronic fatigue and mild anxiety. The instructor needs to select the most appropriate type of Qigong practice to address these specific concerns, considering the client's overall well-being and potential contraindications. Option A. Recommend a dynamic Qigong form known for its vigorous movements and emphasis on physical exertion, as it is generally beneficial for improving energy levels. Option B. Advise the client to engage in advanced Qigong techniques that involve complex postures and intense internal focus, as these are known to yield the most profound results for energy imbalances. Option C. Propose a Qigong practice primarily focused on external martial arts application, as the discipline and physical conditioning involved can indirectly help manage fatigue and anxiety. Option D. Suggest a gentle, meditative Qigong practice that focuses on breath awareness, subtle energy cultivation, and mindful movement, specifically designed to calm the nervous system and restore vitality. The correct answer is A. Recommend a dynamic Qigong form known for its vigorous movements and emphasis on physical exertion, as it is generally beneficial for improving energy levels. Explanation. This scenario presents a professional challenge for a certified Qigong instructor by requiring them to assess the impact of different Qigong practice types on a client's specific health condition, necessitating a deep understanding of Qigong principles and their potential applications within a safe and ethical framework. Careful judgment is required to avoid making unsubstantiated claims or providing advice that could be detrimental. The correct approach represents best professional practice because it prioritizes a holistic understanding of the client's needs and the appropriate application of Qigong. It involves a thorough assessment of the client's condition, a clear understanding of the distinct characteristics and intended benefits of various Qigong forms, e.g., medical Qigong for specific ailments, dynamic Qigong for physical conditioning, static Qigong for mental focus, and the ability to match these to the client's goals and limitations. This aligns with the ethical responsibility of a certified Qigong instructor to provide safe, effective, and individualized guidance, ensuring that the chosen practice is suitable and beneficial without overstepping professional boundaries or making medical claims. An incorrect approach that focuses solely on the most popular or widely recognized Qigong forms, without considering the client's specific needs or contraindications, would be a regulatory and ethical failure. This demonstrates a lack of due diligence and a failure to adhere to the principle of do no harm. Another incorrect approach that involves recommending Qigong practices based on anecdotal evidence or personal preference rather than established principles and client assessment would also be a failure. This disregards the need for evidence-informed practice and personalized care. Recommending a complex or advanced Qigong form without assessing the client's foundational skills and physical capacity would be a significant ethical lapse, potentially leading to injury and undermining the client's trust and progress. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a comprehensive client assessment, including their health status, goals, and any limitations. Second, thoroughly understand the various types of Qigong practices, their theoretical underpinnings, and their typical applications. Third, critically evaluate how each Qigong type might impact the client's specific situation, considering both potential benefits and risks. Fourth, communicate clearly with the client about the rationale behind any recommendations, ensuring informed consent. Finally, maintain ongoing observation and be prepared to adjust the practice as needed, always prioritizing the client's well-being and adhering to professional standards. Question 16. The analysis reveals that a long-term practitioner of Qigong, who has recently experienced a flare-up of a pre-existing knee condition, expresses a strong desire to continue practicing a specific standing posture that they believe significantly alleviates their discomfort. However, this posture involves a deep knee bend which, based on general Qigong safety guidelines and the instructor's understanding of biomechanics, could potentially aggravate the client's current knee issue. The certified Qigong instructor is faced with the dilemma of respecting the client's perceived benefits versus ensuring their physical safety. Which of the following represents the most appropriate course of action for the certified Qigong instructor in this situation? Option A. Allow the client to continue practicing the deep knee bend in the requested posture as they report it helps, assuming their self-assessment of benefit outweighs any potential risk. Option B. Immediately prohibit the client from performing the deep knee bend in the requested posture, citing it as a direct contraindication due to their knee condition, and insist on a completely different set of exercises. Option C. Gently explain the potential risks associated with the deep knee bend in the requested posture, given their knee condition, and collaboratively explore modifications or alternative postures that can achieve similar benefits without exacerbating the knee issue. Option D. Provide a general warning about knee safety in Qigong, but allow the client to proceed with the posture as they see fit, without offering specific guidance or alternatives. The correct answer is C. Gently explain the potential risks associated with the deep knee bend in the requested posture, given their knee condition, and collaboratively explore modifications or alternative postures that can achieve similar benefits without exacerbating the knee issue. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified Qigong instructor to balance the client's perceived benefits of a specific Qigong posture with potential contraindications and the instructor's duty of care. The client's insistence, coupled with their self-reported positive experience, creates a dynamic where a direct refusal might alienate the client, while uncritical acceptance could lead to harm. The instructor must navigate this by prioritizing safety and evidence-based practice within the scope of their certification. Correct approach analysis. The correct approach prioritizes the client's well-being and adheres to the fundamental principles of safe Qigong instruction. It involves a thorough assessment of the client's physical condition, a clear explanation of potential risks, and a collaborative decision-making process. This aligns with the ethical obligation of a certified Qigong instructor to do no harm and to provide instruction that is appropriate for the individual's capabilities and limitations. It also reflects the regulatory expectation that instructors operate within their scope of practice, which includes understanding contraindications and modifying practices as necessary. Offering alternative postures or modifications demonstrates a commitment to client-centered care and ensures that the client can still engage with Qigong safely and beneficially. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the client's request and rigidly adhering to a preset curriculum without considering individual needs. This fails to acknowledge the client's agency and their subjective experience, potentially undermining trust and discouraging their continued practice. Ethically, it neglects the principle of individualized instruction. Another incorrect approach is to blindly accede to the client's request without any safety assessment or explanation of risks. This directly violates the instructor's duty of care and the principle of do no harm. It could lead to exacerbation of existing conditions or the development of new injuries, representing a significant regulatory and ethical failure. A third incorrect approach is to offer a vague or overly generalized warning without specific guidance or alternatives. While acknowledging a potential risk, this approach fails to empower the client with actionable information or to provide a safe path forward, leaving them in a position of uncertainty and potential danger. Professional reasoning. When faced with a client's request that may have safety implications, a certified Qigong instructor should employ a structured decision-making process. This begins with active listening and empathetic understanding of the client's perspective. Next, the instructor must conduct a risk assessment, drawing upon their knowledge of Qigong principles, common contraindications, and any information provided by the client about their health status. This assessment should inform a clear, non-judgmental explanation of potential risks and benefits. The instructor should then collaborate with the client to explore safe alternatives or modifications that meet their goals while mitigating risks. If, after this process, the instructor believes the requested posture poses an unacceptable risk, they must have the professional integrity to decline or modify the practice, always prioritizing the client's safety and well-being. Question 17. Benchmark analysis indicates that a certified Qigong instructor is working with a client who has a diagnosed chronic obstructive pulmonary disease, COPD. The client expresses a strong interest in using Qigong to improve their breathing capacity and overall respiratory health. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for a certified Qigong instructor in this situation? Option A. Design a personalized Qigong program that directly targets the client's COPD symptoms, aiming to reduce inflammation and improve oxygen exchange, and assure them it will significantly alleviate their condition. Option B. Recommend specific Qigong breathing exercises known to enhance lung function, while advising the client to continue all prescribed medical treatments and consult their physician about any changes. Option C. Provide general Qigong movements that promote relaxation and stress reduction, without specifically addressing the client's respiratory condition or inquiring about their medical history. Option D. Suggest that the client discontinue their prescribed medications and rely solely on Qigong practices for managing their COPD, as Qigong has been shown to be highly effective in reversing such conditions. The correct answer is B. Recommend specific Qigong breathing exercises known to enhance lung function, while advising the client to continue all prescribed medical treatments and consult their physician about any changes. Explanation. Scenario analysis. A certified Qigong instructor is faced with a client presenting with a chronic respiratory condition. The challenge lies in balancing the client's desire for complementary practices with the instructor's scope of practice and ethical obligations. The instructor must avoid making medical claims or providing advice that could be construed as medical treatment, while still offering safe and beneficial Qigong practices. This requires a nuanced understanding of what constitutes appropriate guidance within the regulatory framework for certified instructors. Correct approach analysis. The correct approach involves a thorough assessment of the client's condition, consultation with their healthcare provider, and tailoring Qigong exercises to support general respiratory health without claiming to treat the specific condition. This aligns with the ethical imperative to act within one's scope of practice, prioritize client safety, and collaborate with medical professionals. Regulatory guidelines for certified instructors typically emphasize non-medical advice and a focus on well-being, making this approach the benchmark for professional conduct. Incorrect approaches analysis, offering specific breathing techniques designed to cure or reverse the client's respiratory condition, constitutes practicing medicine without a license, a clear regulatory and ethical violation. This oversteps the instructor's scope of practice and could lead to harm if the client relies on Qigong instead of prescribed medical treatment. Recommending dietary changes or herbal supplements to address the respiratory issue also falls outside the scope of a Qigong instructor. This is the domain of registered dietitians or medical practitioners and represents an unauthorized practice of nutrition or herbal medicine, violating professional boundaries and potentially causing harm. Ignoring the client's respiratory condition and proceeding with a generic Qigong routine without any consideration for their health status is negligent. While not directly practicing medicine, it fails to uphold the ethical duty of care and could inadvertently exacerbate the client's condition or lead to unsafe practice, contravening the principle of do no harm. Professional reasoning. Certified Qigong instructors must adopt a decision-making process that prioritizes client safety and adheres strictly to their defined scope of practice. This involves 1. Understanding the client's health status and any pre-existing conditions. 2. Recognizing the boundaries between Qigong instruction and medical advice/treatment. 3. Emphasizing the importance of consulting with qualified healthcare professionals for any medical concerns. 4. Tailoring Qigong practices to support general well-being and complementary health, rather than offering therapeutic interventions. 5. Maintaining clear and honest communication with clients about what Qigong can and cannot do. Question 18. System analysis indicates that a certified Qigong instructor is working with a client who has recently experienced a significant personal loss and expresses feelings of deep sadness and anxiety. The instructor has observed that Qigong practices can help promote relaxation and a sense of calm. Considering the instructor's scope of practice and ethical obligations, what is the most appropriate course of action? Option A. Attempt to provide therapeutic advice and coping strategies for grief and anxiety, drawing upon general knowledge of emotional well-being. Option B. Offer Qigong practices that focus on emotional regulation and stress reduction, while also recommending that the client consult with a licensed mental health professional for their grief and anxiety. Option C. Advise the client that consistent practice of Qigong will naturally resolve their feelings of sadness and anxiety over time, without the need for external professional intervention. Option D. Focus solely on the physical movements of Qigong, avoiding any discussion of the client's emotional state to maintain professional distance. The correct answer is B. Offer Qigong practices that focus on emotional regulation and stress reduction, while also recommending that the client consult with a licensed mental health professional for their grief and anxiety. Explanation. Scenario analysis. A certified Qigong instructor is faced with a client who expresses significant distress and anxiety, attributing these feelings to a recent personal loss. The instructor must navigate the delicate balance between providing supportive Qigong practice and recognizing the boundaries of their professional scope, particularly concerning mental health. This scenario is professionally challenging because it requires the instructor to assess the client's needs, understand the potential mental and emotional health benefits of Qigong, and determine when to refer the client to a qualified mental health professional, all while adhering to ethical guidelines and the scope of practice for a Qigong instructor. Correct approach analysis. The correct approach involves acknowledging the client's distress, offering Qigong practices known to promote relaxation and emotional regulation, and proactively suggesting a referral to a mental health professional. This aligns with the ethical responsibility of a certified Qigong instructor to operate within their scope of practice. Qigong's benefits for mental and emotional well-being, such as stress reduction and improved mood, can be supportive, but they are not a substitute for professional mental health treatment. Referring the client to a qualified therapist or counselor ensures they receive appropriate care for their specific mental health needs, upholding the instructor's duty of care and professional integrity. This approach prioritizes the client's overall well-being by integrating supportive Qigong with specialized mental health support. Incorrect approaches analysis. One incorrect approach is to solely focus on Qigong exercises without acknowledging the depth of the client's emotional distress or suggesting professional help. This fails to recognize the limitations of Qigong as a sole intervention for significant emotional challenges and could be interpreted as providing advice or treatment beyond the instructor's qualifications, potentially delaying or preventing the client from seeking necessary professional mental health care. This breaches the ethical duty to act in the client's best interest and could be seen as practicing outside the defined scope of a Qigong instructor. Another incorrect approach is to dismiss the client's feelings and insist that Qigong alone will resolve their issues. This is dismissive of the client's experience and demonstrates a lack of empathy. Ethically, it is crucial to validate a client's feelings. Furthermore, it overstates the capabilities of Qigong, potentially leading to disappointment and a lack of trust in both the instructor and Qigong practice. This approach also fails to adhere to the principle of providing accurate information about the benefits and limitations of Qigong. A third incorrect approach is to attempt to provide psychological counseling or therapy without being a licensed mental health professional. This is a direct violation of professional boundaries and ethical standards. It constitutes practicing without a license in a regulated field and poses a significant risk to the client's well-being, as they would not be receiving evidence-based treatment from a qualified practitioner. This is a serious ethical and potentially legal transgression. Professional reasoning. Certified Qigong instructors should employ a decision-making process that begins with active listening and empathetic acknowledgement of the client's concerns. They should then assess whether the client's needs fall within the scope of Qigong's known benefits for mental and emotional health, e.g., stress reduction, relaxation. If the client presents with significant emotional distress, trauma, or symptoms indicative of a mental health disorder, the instructor's primary responsibility is to refer them to a qualified mental health professional. This decision-making process emphasizes client safety, ethical practice, and the collaborative approach to well-being, ensuring that clients receive the most appropriate and effective support. Question 19. During the evaluation of a new client seeking Qigong instruction primarily for stress reduction, the client mentions a recent knee surgery and expresses a desire for a practice that feels energetic. As a certified Qigong instructor, what is the most appropriate initial course of action? Option A. Immediately begin teaching a dynamic flowing Qigong set like Tai Chi movements, assuming the client's desire for energetic means they want vigorous exercise. Option B. Proceed with teaching a vigorous, dynamic Qigong form that involves significant leg work, as the client stated they wanted something energetic, and their stress reduction goals can be met through exertion. Option C. Inform the client that Qigong is not suitable for them due to their recent knee surgery and suggest they seek other forms of stress relief. Option D. Recommend a gentle, static Qigong form, such as seated Ba Duan Jin, explaining how it can effectively reduce stress while being mindful of their knee recovery, and offer modifications for standing postures if appropriate. Correct answer is D. Recommend a gentle, static Qigong form, such as seated Ba Duan Jin, explaining how it can effectively reduce stress while being mindful of their knee recovery, and offer modifications for standing postures if appropriate. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified Qigong instructor to discern the most appropriate pedagogical approach based on a client's stated goals and physical condition, while adhering to the ethical guidelines of the profession. The instructor must balance the client's preferences with their own professional judgment regarding safety and efficacy, ensuring that the chosen Qigong practice aligns with the client's overall well-being and does not inadvertently exacerbate any existing conditions. The instructor's decision directly impacts the client's experience, potential progress, and adherence to safe practice principles. Correct approach analysis. The correct approach prioritizes a thorough assessment of the client's needs and limitations before recommending a Qigong style. This aligns with the ethical imperative for instructors to act in the best interest of their clients, ensuring safety and promoting effective learning. By considering the client's stated goals, stress reduction, and physical limitations, recent knee surgery, the instructor can then judiciously select a Qigong modality that is both beneficial and safe. Recommending a gentle, static form of Qigong, such as Ba Duan Jin in a seated or modified stance, is a best professional practice because it minimizes physical stress on the knee while still allowing the client to experience the stress-reducing benefits of Qigong through breathwork, mindful movement, and energy cultivation. This demonstrates a commitment to client-centered care and responsible instruction, adhering to the implicit guidelines of promoting well-being and preventing harm. Incorrect approaches analysis. Recommending a dynamic, vigorous form of Qigong without modification, despite the client's recent knee surgery and stated goal of stress reduction, would be a significant ethical failure. This approach disregards the client's physical limitations, potentially leading to injury and exacerbating their condition, which violates the principle of do no harm. Furthermore, it fails to tailor the practice to the client's specific needs, demonstrating a lack of professional judgment and client care. Another incorrect approach would be to solely rely on the client's initial request for a fast-paced Qigong without further inquiry. While client preference is important, an instructor has a duty to guide clients towards safe and effective practices, especially when physical contraindications exist. This approach prioritizes client desire over professional responsibility and safety. Finally, abandoning the client's request altogether and refusing to offer any Qigong practice without a clear, justifiable reason, such as a severe medical contraindication that requires physician clearance, would be a failure to provide professional service and support, potentially leaving the client without beneficial practice. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and thorough client assessment. This involves understanding the client's goals, any physical or medical conditions, and their experience level. Following assessment, the instructor should apply their professional knowledge of different Qigong styles, considering their respective benefits and contraindications. The decision should then be a synthesis of client needs, safety considerations, and the instructor's expertise, leading to a tailored recommendation. This process ensures that the chosen practice is both effective and appropriate, upholding professional standards and ethical obligations. Question 20. Risk assessment procedures indicate that a certified Qigong instructor is preparing to teach a new group of students with diverse backgrounds and levels of prior knowledge. The instructor needs to introduce the theoretical foundations of Qigong, which approach best ensures accurate and responsible education while respecting the depth of the practice. Option A. Explain Qigong's theoretical foundations by referencing established principles of Kai cultivation, meridian theory, and the interplay of mind, body, and spirit, acknowledging the historical and philosophical context of these concepts. Option B. Focus on anecdotal testimonials from practitioners about their personal experiences and perceived benefits of Qigong, as this is what most students are interested in. Option C. Present Qigong theory as a series of simple, easily digestible metaphors and analogies, avoiding any complex terminology or historical context to ensure maximum accessibility. Option D. State that the theoretical foundations are less important than the physical movements, and that students can learn the practical aspects without needing to understand the underlying theory. The correct answer is A. Explain Qigong's theoretical foundations by referencing established principles of Kai cultivation, meridian theory, and the interplay of mind, body, and spirit, acknowledging the historical and philosophical context of these concepts. Explanation. This scenario is professionally challenging because it requires a certified Qigong instructor to balance the theoretical foundations of Qigong with the practical needs and potential sensitivities of a diverse group of participants. The instructor must ensure that the theoretical explanations are accurate, respectful of traditional principles, and accessible without oversimplifying or misrepresenting complex concepts. Furthermore, the instructor must consider how these theoretical underpinnings inform safe and effective practice, especially when dealing with individuals who may have varying levels of understanding or physical conditions. The correct approach represents best professional practice because it prioritizes accurate and nuanced communication of theoretical foundations. By grounding explanations in established Qigong principles and acknowledging the historical and philosophical context, the instructor upholds the integrity of the practice. This approach demonstrates a commitment to providing participants with a genuine understanding of Qigong's theoretical underpinnings, fostering deeper engagement and respect for the discipline. This aligns with the ethical obligation of a certified Qigong instructor to educate accurately and responsibly, ensuring that participants receive a comprehensive and authentic learning experience. An incorrect approach that focuses solely on anecdotal evidence or personal interpretations fails to adhere to the established theoretical foundations of Qigong. This can lead to the dissemination of misinformation, potentially undermining the credibility of the instructor and the practice itself. Ethically, this approach breaches the duty of care to provide accurate instruction. Another incorrect approach that emphasizes overly simplistic or sensationalized explanations risks trivializing the depth and complexity of Qigong theory. This can lead to a superficial understanding among participants and may even create unrealistic expectations about the practice's benefits. This approach fails to meet the professional standard of providing thorough and meaningful education. A further incorrect approach that dismisses the importance of theoretical foundations entirely in favor of purely physical movements neglects a crucial aspect of Qigong. Qigong is not merely a set of exercises. Its efficacy and depth are intrinsically linked to its theoretical framework, including concepts of Kai, meridians, and mind-body integration. Ignoring this aspect provides an incomplete and potentially less effective practice. The professional decision-making process for similar situations involves a commitment to continuous learning and a thorough understanding of Qigong's theoretical underpinnings. Instructors should consult reputable texts, experienced mentors, and established lineages to ensure their knowledge is current and accurate. When explaining concepts, they should strive for clarity, precision, and respect for the tradition, adapting their language to suit the audience without compromising the integrity of the information. A critical self-assessment of one's own understanding and the potential impact of their explanations on participants is paramount.